So you do a better extraction.
Well, I don't know if I would say a better extraction. It's a better process of the extraction. Because, you know, if you were to look at our books and the description of how extractions need to be done, the science behind it is old. It's almost 100 years old.
Basically just pulling the tooth out.
Exactly. And there's a certain way that they teach.
Well, what's wrong with that?
Well, there's a lot wrong with that. You lose a lot of bone when you're doing it that way. I mean, the studies show that the average person loses about 2 to 3 millimeters of bone support, cortical bone support, when you're traumatically removing a tooth.
So what's the problem with that, by the way?
Well, when you lose bone, the chances of replacements with implants and the need for bone grafts in the future, you know, the surrounding teeth that are around it, when you lose bone from one side.
They start to collapse?
Exactly.
Okay.
So, you know, and again, you know, it's about also the comfort of the patient. When you get an atraumatic, non-traumatic extraction, it makes you feel better. I mean, I was turned on to this system called the O-gram system.
O-gram?
O-gram, right.
Okay.
I actually asked the founder of the O-gram system why he named it O-gram, because he's actually a biomedical engineer, which is an interesting fact here. And it was actually his daughter's name, Margot. He just flipped it and put the 2 dots on top, made it O-ram. He's German of origin. Well, the O-gram system is, simply put, it's about atraumatically removing a tooth from your mouth without causing any bone loss.
What does that mean?
Removing that tooth very skillfully, simply, without causing any kind of damage to your existing bone. This way we can offer you...
But what's the mechanism?
The mechanism is very simple. It's based on holding... Well, there's special kind of tools that were invented. And I want to talk a bit about the regular tools that we use for extractions. If you were to bring... They're numbered, like a 150, 151, so to speak, okay? But if you were to bring 5 different manufacturers of the 150 and you lay them out on the table, no 2 will be the same. You will have 5, but not 2 will be the same. There's a problem with that. Well, your tooth, the morphology of teeth, is pretty much almost the same. But when you have the same tool, which is a 150, and not 2 are the same, well, then that tells you that the way they're going to conform to that tooth is going to be a bit different.
So they're like little pliers.
Exactly,
kind of.
they're little
they
pliers.
Grab onto the teeth.
They grab onto the teeth, but they don't grab onto the teeth very well. So the O-gram guy invented these special tools, very simple, very small, by Schumacher in Germany. And, you know, basically you hold onto the pliers, you hold onto the tooth with the pliers, with just 2 fingers, and you shake up that tooth for about 30 seconds to a minute.
Like a post out of the ground.
Yeah, just with 2 fingers, no power whatsoever. No, you don't need no force. A 5-year-old can do this. You could just, we call it luxation. You just, you know, move the tooth just slightly, okay, for about a minute. And you just let the patient sit. Let them get on their phone. Today, we're lucky we have iPhones. Everybody's on the phone. They don't get bored. Just let them sit for about 30 minutes. Okay. And then when you come back, you can literally roll out that tooth. The mechanism behind it is very simple. Yes. The fibers that are around the tooth, once you shake up that tooth, there are enzymes that are released, collagenases, that break down the fibers from around the tooth. The tooth is not stuck in the bone. There's a gel, there are fibers that are surrounding it. Once you break that attachment, it just rolls right out.
Is that right?
Yes. And then there's, of course...
So because of this, it's not as sore to the patient?
It's not as sore. It's not as traumatic. Experience-wise.
So lower downtime,
absolutely.
less pain.
You won't be traumatized. A lot of people don't come back to the dentist because of trauma.
Why does every dentist do this? If what you're saying is true, it logically makes sense.
That is true. And again, it's becoming, a lot of people are starting to do this. Dental schools are starting to teach this system, believe it or not. And there's a lot more involved with that. A lot of times when you remove a tooth atraumatically, you can scan the root. You can do a scan of that root that you just took out and fabricate an implant that is exactly the same shape of that root and insert it back into that socket. Now, some of these procedures are still not done here in the US, but they're done overseas in Germany and other places.
So if you're going to get an extraction, ask the doctor, do you have this technology?
O-gram, yes, O-gram system. Yeah, they've got their own website on, and it just explains the process of how to do that. I think the major, there's 2 major advantages to this system. First of all, on a personal psychological level, it's not as a traumatic, extractions are a traumatic experience for somebody to go through. If you've been through any extraction, like wisdom teeth extractions, it's not a very pleasant thing. A lot of people opt to go under general anesthesia to do that. And you know, with the risk of general anesthesia, I would try to stay away from it. But just the fear of having to go through that extraction.
And this just kind of wiggles out.
It just wiggles out, yes. And of course, there's a skill behind it. I mean, you got to learn it. There's a course that you got to go to.
At it.
Well, I've taken the course and I've done it. That's
Okay,
the thing.
so you're doing it a
Experience
lot.
makes out.
Yeah,
we do it quite a bit. And it's very important for orthodontic extractions. When you're having an orthodontist that's going to pull out those first bicuspids, and they're going to need that surrounding bone for braces, right? You can't damage that bone. If you damage it, you're damaging. These are 14, 15-year-old children. If teenagers, you're setting up for failure. If the tooth is removed traumatically, the bone is going to be damaged, and the entire orthodontic treatment is going to fail.
So the O-gram.
The O-gram, atraumatic removal. I've had fathers watch. I actually bring them in the room to watch what I'm doing, and then the
parents
comes
out, they're amazed.
Oh yeah, they're amazed. And then when I'm waiting that period, like, are you going to start? I was like, no, we're going to wait a little bit more. It's like, what are you waiting for? So I give them a briefing. I actually keep the parents busy just to explain to them what the process is, and they love it. They love it. I mean, but it's all about keeping up. Keeping up in any kind of profession. You got to keep up with what's coming out and what benefits people. I mean, I'm sure you do it in your business, and everybody else should be doing it in their business. You got to offer the latest, the top quality, and what works for people, and what makes it less traumatic in all senses. Whether it's psychological or physiological. So.